Hi everyone, my name is Mariah and I'm a registered kinesiologist working at Curans Heart Centre, and I'm here to inform you about a new service that will be coming to Curans in the area of cardiometabolic research. The service is known as a DEXA scan. So what is a DEXA scan? Well, a DEXA scan is a medical imaging device that collects information to measure someone's bone density. We can use that information to evaluate the risk of developing disease such as osteoporosis or risk of fracture. It is also used to measure someone's body composition, where we can use it to track changes of fat or muscle tissue over time and also estimate someone's risk of developing different metabolic disorders by evaluating their visceral adipose tissue percentage within their body. So currently, DEXA's role in cardiometabolic research is pretty variable, but it's used in a wide variety of studies. It's mostly used as a secondary outcome in studies where you might use it in adjunct to other tools and devices such as the BMI, BSA, waist to hip ratio, and other blood biomarker tools as well. Typically, you see them most involved in weight loss studies where we can track fat changes over time. It can also be used in endocrine studies where we can evaluate disease prevention and risk stratification, such as in diabetes or PCOS. And it's also used in a lot of clinical nutrition and exercise physiology studies too. So DEXA's software and programming has evolved quite significantly over recent years. Most recently, its newer software upgrades allows clinicians or investigators to measure and evaluate someone's risk of developing different metabolic diseases. And by doing so, they use the visceral adipose tissue area estimation calculation. What this does is it estimates the percentage of potential visceral adipose tissue that might be around someone's organs, so that's the fat around your organs, and they can use that to potentially predict disease. When we compare DEXA to other commonly used tools like an MRI or CT scan, which most people might be aware of, you can see that DEXA scans are very easy, they're very accessible, and they're inexpensive compared to CT and MRI. A DEXA scan takes roughly about 10 minutes to take. It's very safe. It emits very low radiation. So one DEXA scan is equivalent to 1/10 of a chest X-ray, if you're curious. DEXAs are great for longitudinal studies where we can track changes over time. And it's a very good diagnostic tool for evaluating disease regarding bone density, like osteoporosis, for example. So in DEXA, we are hoping to bring this into Curans Heart Centre and use it for a variety of different areas in research specifically. We want to use it as kind of a tool in our cardiometabolic research as we evaluate cardiac risk assessments and hopefully create preventional tools that can help stop disease before it starts becoming an issue for most people. We also want to use it within our lifestyle programs such as the Motion and Action exercise program, where we can use DEXA-derived measures to track changes to someone's body composition over time and potentially evaluate the risk of developing other metabolic diseases like diabetes, for example. So this concludes our presentation. We look forward to seeing you, and DEXAs will be coming soon to Curans.